Good afternoon, everyone, and thank you to our fourth and final session in the February 2015 Nuclear Waste Online webinar series. Today we have Teresa McClenahan from the Canadian Environmental Law Association, and the presentation this afternoon is on emergency planning in the nuclear age. And we'll have a presentation from Teresa and then move to a discussion period. So thank you very much, Teresa, and welcome to the webinar.
Thanks very much, Brene. And just going to do a sound check because I noticed as soon as you started the recording, your voice started a little part of words. So can people hear me okay? Just write down in the box that you can hear me. Nobody's responding. I'm gonna wait until I make sure people hear me before I launch it. Yes, okay, thank you. All right, so thanks for inviting me. And, oh, it's a little jumbled. That's too bad. So my topic for this year is emergency preparedness and high-level nuclear waste. And I will try to leave some time at the end for some discussion and questions. So I'm going to a little bit about jurisdiction and what the available statutes provide around emergency planning and high-level waste, and then a bit of the current sufficiency of Canada's emergency readiness, by that to high-level emergency response. So first of all, as you may have heard in other presentations, we have the division of national powers in Canada among levels of government, and regulation of matters has been designated to be federal. That's pretty settled. But there may still be rural, provincial, environmental, transportation, or other laws that also apply in certain circumstances. So if there were both, and if there was a conflict where one couldn't follow because of the other, the court would say the federal law is paramount. So part we're looking to federal legislation, but in the case of emergency planning, a large provincial role, as you'll see as we go through here today. So in terms of the law that governs, it's a piece of legislation that I know many of you on the call are from other proceedings and hearings. It's the Nuclear Safety Control Act. This is the statute that deals with nuclear energy matters in Canada. And this deals with all from mining to operating various facilities, decommissioning those facilities through management. And it's the Canadian Nuclear Safety Commission, or CNSC, I will refer to it today, that is charged with administering law. And so how does that legislation deal with emergency preparedness? So two overarching purposes of that act are, first, that it's supposed to have all of the players limit to a, quote, reasonable, the risks to national security, health and safety of persons, and from any use or possession of nuclear substances in any way. And high-level nuclear waste would be a nuclear substance under various pieces of the definition in that law. The CNSC's job, among other things, is to regulate the possession and use of nuclear substances to meet the purposes of the Act. So whenever you're engaging in anything to do with high-level nuclear waste or any other nuclear activity, vis-a-vis the CNSC, you should relate back what you're saying to the CNSC to their job, which limit that activity to a reasonable level. And it's perfectly appropriate to say what you think. They may not always agree with you, but it's quite an appropriate thing to talk about. So then every aspect of the nuclear fuel chain requires a license from the CNSC. I'm not going through that today, but for example, relevant to today's topic, transporting high-level nuclear waste down the road, which isn't done today, but if it, well, there's the HEU proposal, but that isn't done today. in general, most of the high-level winds at the facilities today. But if that were to be done, there would need to be a licensee. Similarly, building a facility of any sort to house, store, or dispose of nuclear fuel would also require a new license from the CNSC. And again, I'm not getting into the licensing scheme today or the environmental assessments that would be required, the hearings or anything like that. And then if those activities were occurring and you had some kind of emergency, then there are powers in the legislation, general extraordinary powers that apply everything the CNSC regulates, and those would be available. For example, act if they think there's an unreasonable risk, if they think there's unsafe transport or unreasonable risk in the storage or housing of any nuclear substance. And there are many sections in the Act that set out their powers back. The fact that sometimes they can do warrantless searches, they can search vehicles, they can enter facilities, take samples, conduct tests, and issue orders. They're very general powers that you see in much environmental and safety legislation and are meant to provide a bit of a backstop that if we haven't thought of a specific circumstance, the inspectors still have the power to the other thing is around notification, and a section of the Act requires that if there was an event that in exposure to people or to the environment to an excess dose, and by that they mean excess over the regulations, then there has to be immediate to the CNSC or the appropriate authority. So if you're a nuclear power plant, they've got somebody at the CNSC they have to notify. But what I've included here on the list of slides, and for future reference when this gets posted on Brene's site, are some phone numbers around events in Ontario, and there is a general agreement, as I'll describe in a minute, whereby even for active accidents, the notification goes to provincial call centers. So the Ontario Spills Action Centre here also put a note that Ontario health workers who have a patient dealing with emergency or exposure should call the Ministry of Health and Long-Term Care hotline under the very new radiation health plan that I'll talk about later. And then the regulation that sets out the notification arrangements, all numbers for Quebec, Manitoba, every other province in the country. I could have included a number perhaps for New Brunswick. And interestingly as well, measures Ontario has a nuclear planning brochure giving a different number if you them to host community outreach sessions on their provincial nuclear emergency plan. Of you on the call today, if you have an interest in this, would like to take them up on that. So what governs responding to nuclear emergencies? Overall, there's a general emergency plan federally, there's one provincially, and in each municipality. And I've given you a link there to the emergency response plan, which dates to January 2011. It's a general plan to cover all emergencies, but it does include specifically Transport Canada's response functions, and those include things like restricting traffic and providing technical emergency advice on hazardous materials. That's something I pulled out in particular of relevance to us. And then there's a specific plan, the Federal Nuclear Emergency Plan, which is found on the Health Canada website. It also is a few years old and does apply to small amounts of radioactive material. But otherwise, any emergency that includes nuclear material or nuclear so radiological or nuclear emergencies are covered in the Federal Nuclear Emergency Plan, and then again there are other plans in the provinces, which is shortly, at least for Ontario. And it's got some general goals: regaining control of the situation, preventing dose to persons, radiological health effects. And it's, a very long plan, so I'm trying to the the most germane aspects of it in a short piece here, but it does have charts about who's to be notified, who provides advice, who gives field support, what other federal functions there are in nuclear. Fuel waste facilities are not specifically identified and at this point, and fuel waste transportation is also not specifically identified. So those would fall into a category under the plan called nuclear, not otherwise listed. So then we have the plan, which dates to 2009, so prior to the Fukushima Act. It covers many things, including other radiological emergencies, and that other radiological emergencies includes transmission. Interestingly, the plan sets out what's the planning basis or the type of or size of response that might be needed, and what the responding municipalities and other actors to be prepared for. It specifically says that detailed planning is right for an accident where, quote, doses would be low, end quote. And more severe accidents only require, quote, appropriate planning and preparedness to plan for matters. And I will. So this is the extent of what the plan says for their accidents, that there should be timely public alerting and direction, that there should be priority evacuations for those closest to the hazard, radiation monitoring and, if necessary, decontamination, and medical assessment, treatment, and counseling. So that's at a high level, and as I said, the detailed planning is done at time closer to the plants, as I'll explain today, for often nuclear plants and for accidents where doses would be low. So what could happen if you did have to act in special circumstances? So what the current provincial plan says is that you might have to modify some of the planning that exists today around these topics. So you might have to do something specific around exposure control, and the kinds of things they have in mind are controlling entry to an area, ordering sheltering in a certain type of thing, evacuating an area, issuing potassium iodide, thyroid blocking to protect against radioactive iodine, using protectant and decontaminating an area. And then it also congestion control measures. Now these are also applicable in the plans they do have. If you had a special circumstance, then they also issue directions on some of these things, like whether milk is being into the general consumer system from cattle in the affected area, whether the drinking water supply is allowed to be distributed to and consumed, whether animals are going to be allowed in pastures that might be affected or an event or a spill. Similarly, produce and livestock control, food control, both in terms of sale and things getting into the food system, control of land, and eventually decontamination. Pardon me. So basically what I've said before about this is that for accidents that are not anticipated at the operating plant, close to the operating plants and within a relatively controlled scenario, it's basically a plan to have a plan. That's what it amounts to. So what about fuel waste facilities and fuel waste transfer? Are there specific plans? I was unable to find any specific emergency response plan yet available for either high-level fuel waste transportation or the potential fuel waste facilities like the DGR2. And that would be because presumably they don't have a fuel site selected or a facility underway. Similarly, there's no specific nuclear emergency response planning yet in transportation routes for that high-level waste. Those of you involved in the HEU may be able to tell me whether there's something specific that's happened around that, because I haven't been delving into that. But in general, for the future high-level fuel transport from the operating plants, that's not yet in place. However, the province's provincial nuclear emergency response plan does say radiological emergencies, as opposed to emergencies at the plants, can occur where. And they do have some provisions then about what should happen. Emergency response is supposed to set up a downwind protective action zone, which primarily includes activities like monitoring the extent of any contamination, and a controlled zone that they can actually control, like whether they can control getting into that area, for example. And the controlled zone is supposed to include and warm zones, which are defined according to the extent of radioactive contamination. So in the meantime, if there was an emergency involving the current stores of high-level fuel waste that's currently stored at nuclear power plants, this would be covered by the municipal offsite response plans and the provincial and federal plans that are presently in place for nuclear emergencies. So a bit of a discussion about what those do and what state they're in. Overall, what I think a theme is that I've found after looking at these for the last years is that various pieces of these plans are coming into place remarkably late. And by that I mean we've had these plants operating in Ontario in some cases for approaching 40 years or maybe already 40 years. And yet something as basic like the comprehensive emergency alerting and system in Durham region is only recently being fully implemented as only intended. And leading up to the Darlington and the Pickering hearings last year and the year before, well, 2013, 2012, there was extensive at the Canadian Nuclear Safety Commission about the fact that some irons have not been operational. They weren't fully able to reach even the 3-kilometer zone they were supposed to reach. And then other measures to reach people within the 10-kilometer zone only then being implemented, some of the calling services and so on. And in any case, they haven't yet moved to the kind of new social media type methods of alerting, although they are actively working on that. At the day one licensing hearing earlier this month did describe a number of new alerting systems that they're presently implementing, some of which is some new CRTC radio band licensing to get broadcast space, and some new devices that people can have in their homes. And so that's a step up, but again, we're talking about plants that have been in operation for a long time, and it would be my opinion that alerting should have been one of the first things that was, very well in place. We also have the new development for pre-distribution of potassium iodide to residents within 10 kilometers or the primary zone is otherwise defined around a nuclear operating plant. And that needs to be in place by the end of 2015. So this would be relevant to protect against iodine-related thyroid cancers, and is relevant to radioactive iodices in certain accident scenarios. So it's dealing with one component material that could be released in an accident. It's a very important measure. Sean Patrick, who's on the call, Janet McNeil Nuclear, and many others had been working quite hard on at least getting distribution done. But I have to say this was being called for, has been in place in other jurisdictions for years and years, and has been recommended in Ontario by authorities decades ago. And it's only now, in the wake of not only FEMA, but very strenuous advocacy on the part of the public at those recent licensings, that this is actually coming into force. Another major issue is sheltering as one of the measures that might be read by authorities. And in this, it can be appropriate. What I'm about is there needs to be much more clear communication about when it's appropriate and what type of sheltering could be effective. So, for example, the Health Canada guidance and the international points out to nuclear emergency planners that would frame how are not effective for gamma radiation, one type of which is cesium-137. So sheltering within a concrete structure is more effective. So if somebody's in an institution like or a senior's home that happens to be entirely constructed of block concrete, be effective in certain circumstances. So it depends what is happening in a particular accident and what is potentially being emitted to the environment in that accident. But I really want people to think that it's a panacea in all circumstances. In many circumstances, evacuation could be the essential primary needed to avoid radioactive exposure, get people out of the area and far away. But I have a concern, having looked in pretty close detail, at least at the Durham plans, and I will be looking in more detail at the Bruce plans in upcoming weeks, that the evacuation modeling are largely untested. Now, Durham's at least done a decent job of modeling their sectors and the numbers of people in their sectors and how many schools and that kind of thing, and they've done a reasonable in estimating timeframes. Although I noticed that the timeframes are underestimated in public at the hearings, where they don't talk about the sectors that will take the most time. They talk about averages. But in any event, those plans are limited to 10 kilometers with some requirement for modeling another 5 kilometers, what the U.S. has called shadow evacuation. So I'm concerned that realistic traffic movement and control in any accident would be critical. And of course, if you're in an area where there aren't alternative highways, which is the case with fuel transportation in the future, or where is adjacent to highway should realized, you could end up with major restrictions on transit without exposing people to doses that you don't want if on those routes. And then the plans talk about care of animals being something to think about. They don't specifically deal in the plans, but anyone who has animals, like farmers, would definitely have to think about. And in point of fact, it will absolutely affect, what people do in an accident. So another major issue is controlling ingestion, anything that might contain radioactive materials, whether that's eating or drinking or breathing, because you don't want certain radioactive contaminants to be internal. They can then cause a lot more damage and be harder to deal with. So the ingestion control zones that are out in the province's plans are bigger. The primary zones in Ontario right now are 10 meters. The secondary zone for ingestion control is 50 kilometers for the Pickering, Darlington, and Bruce facilities. So in the case of a fuel waste facility, there'd have to be something analogous, and in the case of a fuel transportation accident, you'd have to think about ingestion control around the source of the accident as well, in order to ensure that people aren't eating or radiologically contaminated food or milk or water. And both the federal and provincial officials have lists of who should give advice and directions on ingesting the accident and the monitoring they're getting back. And if you're interested in knowing what some current advice is, and it's intended in advance that people can act quickly, there are protective action levels and in control measures set out in Annex E to the provincial plan, and I gave you the provincial plan earlier in the slides, so if you go back on later, you could go there and see it. And I just picked one so that you would have some idea of the kind of thing it sets out. So it says cesium-134 shouldn't exceed 1 kilobecquerel per liter water, food, or milk. And I pitched that one because it was the same unit whether infant or adult, and across these ways. So the other thing that the plan provides for is radiation monitoring. So for the general public, they talk radiation monitoring at emergency reception centers. There's also general advice that's intended to be provided to the public that if they've been exposed, like let's say they were close to an accident where it's being announced that there was some kind of emission, they remove and bag their clothing and shower with soap and water. And then environmental monitoring is also provided. There are in place that the Ministry of Labour monitors, and it's intended that they have a role in relaying the monitoring information as well. So there's been more attention to licensing hearings on the environmental monitoring systems operated by plant by the province. And again, in a proposed fuel waste facility, this would be something that would have pretty thorough attention. So the emergency plans also talk about emergency workers and whether they're exposed, how they're exposed. They have a kind of a color coding system depending on their exposures, and they're to be tracked and report in and report out, and have dosimeters for that exposure. The other thing to note is that the power plant communities in Ontario has a municipality designated as the primary zone municipality, so the one that's with emitters of the plant, and other municipalities around them are designated as host municipalities, like receiving evacuees. So there's a chart of those in the, for example, the Fermi 2 plant in Michigan has Amherst rated as a primary zone, interestingly within 23 kilometers, not 10. And in that case, host municipalities are Windsor and the town of Essex. So then I'm going to turn to the Radiation Health Protection Plan, which is one piece of the province's nuclear emergency plan. Now, this has been missing for a long time. It was finalized and posted in 2014. I was actively seeking it ahead of the Darlington hearings in 2011 and 12, and ahead of the Pickering hearing in 2013. And we were constantly being assured that it was almost ready. And finally, it's been posted. It's worth review as well. I was appointed that there wasn't any public input sought. They do list who they had input, including medical officers of health and the LINs, the local health networks around those areas that have hospitals designated under the plan, and many officials, for example. So if there was an accident from a transportation or a high-level waste facility, it would be called a radiological emergency under the plan. I don't see enough of a difference to really understand. Plans insist on having two terms, one for the nuclear operating plants and one for everything else, but they do. But in any case, the emergency occurs under the definition when there is an actual or potential hazard to public health, property, or the environment from ionizing radiation. So fundamentally, the Radiation Health Protection Plan says that it's aiming for principles of time, distance, and shear to reduce dose. And reducing dose is what the Radiation Health Protection Plan and emergency planning in general is all about: avoid or reduce from internal or external exposure to radionuclides. So time meaning reduce the time of exposure to any radionuclides. Distance meaning increase the distance from the source if it was on a highway, for example. And shielding to shield people from the source. And as I mentioned before, it depends on the type of radionuclide and the type of shieldable for the people who are within its pathway that you have to pay. So the plan says that you can reduce internal radiation, which you remember I said is something you want to do to avoid extra harm with personal protective equipment, by controlling the spread of contamination. So if there was some kind of a spill, containing that very promptly would be a major. Decontaminating individuals and items in a timely manner. The Radiation Health Plan does note that decontaminating or treating individuals who have radiation exposure is more difficult than external, and with appropriate pharmaceuticals like potassium iodide, or you'll see it referred to as I or Prussian blue. In terms of medical treatment, in the case of a nuclear radiological emergency, medical treatment may have to be provided by first responders, and the plans that they might have to provide first aid, triage, transport to hospital, and help to spread of contamination. And then medical treatment may also have to be provided by hospitals in the vicinity of the emergency, which in the case of patient may or may not be a hospital that's already designated next to the plants. And their role, first receivers of injured and or contaminated victims, providing medical care, and again preventing spread of contamination. So there are hospitals that are already designated in Ontario as part of the Provincial Chemical, Biological, Radiological Emergency Preparedness Program, and have been issued additional equipment. And they're expected to be able to handle a contamination and have responsibilities that include screening for exposure, triage of those with external contamination versus non-contaminated, monitoring for internal and external contamination, conducting external decontamination, reducing internal contamination, and treating acute symptoms. And there's more detail in the plan for public health units and municipalities having in an emergency. And then the Radiation Health Protection Plan also designates hospitals for each of the operating nuclear plants in Ontario. So for Bruce, it's Kincardine. For Pickering and Darlington, it's the Rouge Valley, Pickering, and Lake Ridge. For Chalk River, it's the Pembroke Hospital, and Fermi has no hospital designated of the slightly greater distance, and the plan says they don't anticipate victims from an accident there. And then Toronto Western Hospital is designated provincially as the radiation trauma unit to treat acute radiation syndrome. So patients would have to be transported there if they needed that kind of distance. By the way, while I'm going over any of this, if there are things that you would like to see changed, strengthened, clarified, keep it in mind, because I'm going to give you some opportunities for input at the end of the slides. And then there are specific teams that have been set up for this range of chemical, biological, radiological, nuclear, or explosive incidents. The teams are located in Windsor, Toronto, and Ottawa. And then other municipalities might have hazardous materials teams. And the plan references the OPP's Urban Rescue, Chemical, Biological, Radiological team, and similar teams at the RCMP and Canadian National Defence. And then the province also has a mobile emergency medicine team deployable within 24 hours across the province. So federal and international assistance agreements through the Federal Nuclear Emergency Plan, and that would be coordinated by the CNSC of whoever was calling for the help. So the Radiation Health Protection Plan outlined 18 scenarios. One of those involves transport radioactive substances. 2 involve events at the nuclear power plants. Accidents and radioactive waste or high-level fuel waste are not themselves singled out in a scenario, so they would fall more generally into scenarios involving radiological emergencies, at least as I read the plan. So then what about the Nuclear Waste Management Organization potential fuel waste site? What's been put on the record so far? It's received limited treatment by NWMO so far, at least as far as Renee and I could with our respective searches. There are some statements that emergency plans will need to be created. The generic proposed underground facility plan says that it will use the ventilation shaft as the emergency exit from the repository. Otherwise, the references in the materials that I could see are generally to hazardous materials transport requirements that we have presently, like the radioactive packaging and labeling requirements, federal legislation, and the provincial legislation and the international guidance on those topics. So CNWMO says that transportation of high nuclear fuel would occur over at least 30 years. I would suggest that emergency planning for the transportation routes would be a pretty critical issue to be thinking about. So again, engaging the NWMO process, this would be something to be raising. So in time, nuclear emergency planning in general is an extremely active element. Many of us have been doing a lot of work on it. Many of us are quite convinced that we're not where we need to be yet in this province, despite our extensive reliance on nuclear power in Ontario. And so I would encourage you to intervene in the upcoming Bruce hearing. Inquests are due mid-March, March 16th, and the hearing is scheduled for Kincardine, April to 16th. And again, when you access these slides later, there's a link to the CNSC hearing, and there's also a link to Bruce Power's website around that license renewal. Darlington also has a relicensing this year in the fall. Both of these were adjourned from last year. Darlington is seeking a 13-year license, is a sort of a standard 5-year request, but Darlington wants 13 years this time. The hearing is tentatively scheduled for November 4th and 5th in Curtis, Ontario, place for those of you who intervened in the previous Durham hearing. And the OPG website for the current relicensing application is also given there on an OPG website. And Renee's saying she's going to post my slides. That's a good idea. And then the province says, many places, that it's on a new provincial nuclear emergency plan. No public consultation has yet been had. We've been disappointed because we thought there was going to be a public consultation. Afraid what might happen is that a lot of work's happening in the back rooms and we're going to see a finished product, very limited willingness to modify it. But anyway, I would encourage you to look at the current plans. All of the current plans, like the Durham plan and the appendices and so on, are at the EMO website on the link I'm giving you there. And then it includes maps of the primary zones and that kind of thing. And then you should also tell Emergency Management Ontario that you want input in reviewing the provincial plan, and I've given you the regular website link. If anybody has a better link, we'll also send it along, but that's what I was able to find for it. So over to you, Bernane.
Great. Thank you very much, Teresa. I'm just going to turn off the record.